If you have a girl child, this is one video you should not miss. When it comes to you as a female, it's important you will know that our reproductive system and the structures down there are different from what you will see in the other gender, that's the male gender. When it comes to the female, the risk of infections are so high. And this risk of infections, you will think it only happens in adults. It happens both in children, and it is very, very common in a girl child. When little children, female children, come down with urinary tract infections and all of these things. And sometimes these urinary tract infections can become recurrent, meaning it goes and comes, it goes and comes. You are in the hospital today, tomorrow you go to the hospital because this infection is almost not going away. So you would expect something like this should happen just in adults. It is common in children. It is common in girls. It is common in toddlers. It is common in preschoolers. It is common in adolescents. So if you have a girl child, you have a baby girl, this is one video you wouldn't want to miss. So as a female, when it comes to the structures down there, you have the vagina down there, you have where you stool from down there, you have the urethra down there. The urethra is where you pee from, the anus is where you stool from. And all of these structures, if they are not properly handled, they can put the baby girl at risk of infections. So let's break it down and make it as simple as possible. So this video, I'm going to be mentioning things, practical things, daily activities you should pay attention to when you're attending to your baby girl. And the first on the list is how you wipe. I know we've said this before, we know we often say, but it cannot be overemphasized. When it comes to how you wipe your baby, do not just say it doesn't matter. Ensure as much as you can, ensure you're wiping from the front towards the back. And the reason is because when it comes to the anus, where the stool is, this area is laden. That is where the poo is. This area is laden with a lot of germs that can put your baby girl at risk of infection. So you do not want to wipe from that back, from the anus to the front, which is where the vagina is, because that is where the vagina is, that is where the urethra, where you pee from, that is where it is also located. So you do not want the sensitive structures to get infected. So as much as you can, if you're wiping, ensure you're wiping from the front towards the back. So another point is some people prefer to use water to wipe. And when they're using water to wipe, some people put the baby in a bowl of this water and they pour the water inside. Remember, this baby is soiled. So the poo, the urine, everything, if you know how the structures down there are, when you put your baby in water like this, with a stool and all of these things, you're putting your baby at risk of infections because the urethra, where you pee from, the vagina, all of these things are all exposed to these germs from the stool. So what do you want to do for it? As much as you can, you can wipe first. When you're done wiping, then you can now use water to wipe your baby. As much as possible, maintain that direction of from front to the back. So with that heavy poop, do not just put your baby in a bowl or you use running water to wipe your baby, and ensure you're maintaining the direction of front to the back. So do not just put your baby in a bowl where there's stool, there's wee wee inside, and you're saying and you're trying to clean up your baby in that kind of bowl. No, you can use running water. You can wipe your baby first. Now use running water, or instead of just putting your baby in a bowl while your baby is still soiled, or you can just wipe first before putting your baby in that bowl. Now, if you just put to bed and you notice the structures down there, like the clitoris is looking enlarged, that is not the time to go and start massaging it, start stretching it, start pressing it, whether with hot water, with mentholatum, with any form of balm. No, you don't want to do that. Aside the fact that you'll be causing your baby some discomfort, you are putting your baby at risk of infections. So you don't want to do that. These structures may be enlarged in newborns because of the hormones they were exposed to while they were pregnant, while they were in the womb. So as baby grows, these structures are going to start to take their normal size. So you do not go on to start pressing, massaging, and rubbing all sorts of concussions or balm or things like that. Do not even apply anything down there. Another point is applying powder. You shouldn't be applying powder down there. In fact, this even goes both to the boys, even to the boy child and to the girl child. Do not apply powder down there. When you apply powder, powder can actually start retaining heat. And the more moist that area is, the more you're going to be putting your baby at risk of infection, because all of the bad germs, all of the bad organisms have a room, a good atmosphere to actually multiply to the point where they can cause your baby infection. So to powder, you don't want to apply powder down to this. As your baby girl grows up, when it comes to wiping from the front to the back, when it comes to how they wipe down there, all of these things are things you can start introducing to them and start teaching them. These are some of the things that can put them at risk of urinary tract infections. So in your daily activities, as you attend to your baby, as you attend to your girl child, these are things you can actually put in place and look into. Hope this video is helpful to you, and I'm going to see you in our next video. Until then, bye.